we were really seeing burnout, like real tangible burnout in the sense that clinicians, both physicians and APPs, were spending 1 to 2 hours just finishing up their documentation. And we made a very conscientious effort. We met and we were like, listen, we really need to, restore the joy in practice and let the technology do what it should, which is remove friction, remove that cognitive burden of the documentation, not add to it. And so Dragon Copilot fits that vision perfectly because it's a tool that listens, understands, writes while the clinician focuses on the patient while they make eye contact with the patient. So instead of staring at a computer screen, they're now having that face-to-face conversation with the patient, making eye contact, showing empathy and compassion. Clinicians are able to talk naturally with patients, and the system is able to draft a structured note instantly. That saves a lot of time, saves a lot of mental energy. If the patient happens to go on a conversation that's like, who won the game last night, or, something tangential about their family that's not relevant to the visit, that's cleaned out of the note. That's taken out of the note, which is fantastic. The notes are much cleaner, they're consistent, and they're ready in workflow, they're available. Some of the clinicians, as a result of this, are telling us that they're saving at least 20, 30, upwards an hour of a day in terms of their documentation and their administrative burden. And so for some of them, they've been able to add extra patients to their schedule, which is fantastic for patient care. I remember this last year. A physician came to us and said, listen, for the first time in years, I've been able to finish my notes before dinner. That to us is very impactful. The rehumanizing the encounter, the patients are instantly noticing, their clinicians are looking at them again, making that eye contact. We've had several patients actually remark that basically, hey, wow, you're not typing today. That's the power of AI. It gives eye contact back to medicine the way it was supposed to be practiced. And because the note is more accurate, the downstream communication improves, which means that if I see a patient and then a consultant comes in to see a patient, or the patient has another visit, there's actually fewer clarification calls that need to happen. There's fewer clarifying questions that we need to ask of the patient. It allows for cleaner handoffs, which now the patients feel that all the members of the clinical team are actually working in sync. We ultimately went with Microsoft because of the security, the compliance, the scalability, and the fact that they've delivered reliable solutions for years. And we firmly believe that Microsoft is going to be the top player in this field.